Reddit Q&A. I am on anxiety medication. Can I be an egg donor? The internet is kind of not helpful at all when it comes to the requirements to become an egg donor. Do you have to be entirely drug-free, recreational and prescription, or just recreational? I live in the US, by the way, if that makes a difference.
Generally, most anti-anxiety or depression medications are acceptable with a few exceptions. So we always review that with a doctor, and generally we have a good idea of what's going to be accepted ahead of time, so we can advise you on that. We usually limit it to about 2 medications though. So if you're taking 3 or more psych meds, then probably it's maybe not a good fit for you.
Yeah, and it doesn't matter US, Canada, where you're based. I find the guidelines are pretty well across the board.
Yeah, in terms of recreational drugs, you do need to be recreationally free of drugs, and that includes cannabis and nicotine, no matter what their legal status is and where you live.
Has anyone donated eggs as an openly trans person? I'm considering the option of donating my eggs, but I've been on testosterone very briefly and I've had top surgery. I don't know if there are fertility clinics out there who'd be open-minded enough to accept eggs from a trans person or not. I only use testosterone gel minimally, and my blood was tested after a short period of using an extremely low dose and it never entered the male range. Will this disqualify me?
But in terms of donating, if you are on testosterone, I think that impacts your quality. So if you've already started testosterone, no, you're gonna have to stop that in order to be a donor. If you're in the prepping stages of taking testosterone, then yes. And I think that's when it would be best to consider being an egg donor before you start the testosterone.
Yeah, as long as your ovaries are not impacted by any additional hormones that you're taking, like if you're not on any extra hormones as part of your transition, then it should be fine. And if you do have working ovaries, it's not so much that the clinics aren't open-minded or that they really care how you identify. They're really just focused on your ovaries.
What's the process like? So I'm 26, healthy and happy. I've been doing a lot of research on egg donation and I'm wanting to do this. However, I want to be 100% sure I know what I'm getting myself into. I know all of the wonderful benefits to doing this, but I want realistic knowledge of the negative effects, the hardships, etc.
So first of all, you're going to be doing a lot of paperwork. It's not a quick process, and you're going to be asked to fill out extensive health information about you and all of your family. You're encouraged to talk to your family members, do a lot of research gathering. You're going to be signing a lot of consent forms, doing a lot of medical tests. So generally you're looking at least a 3 or 4 month period from when you're matched until you actually do the cycle. And then in terms of the medical portion of the cycle, you're going to be giving yourself injections every day for give or take a little less than 2 weeks, and going for a lot of monitoring appointments. So you're going to feel a bit like a human pincushion by the end of that, and you're going to be poked and prodded and have a small surgery. So it is quite a big commitment. So it's good that you're doing a lot of research going into it.
Yeah, that's what I was going to say, is that it's great you're doing research, because I find a lot of people don't do as much research as they should, and it's not like a quick buck, like it's advertised or maybe portrayed online or in the movies. So it's quite intense. Like, we've both been donors, and I don't know, I guess like emotionally, hormones can be up and down. I find I'm pretty okay on medications. I don't know about you.
I feel great.
Yeah, like I'm like,
to be honest, most of my cycles I felt like fertile and glowy.
Yes, the estrogen, I'm like, my skin's great, but
great
then it's like the crash I find I really notice after the retrieval.
Yeah, I usually have about a day of intense mental fog afterwards, after following retrieval. And then of course it's, there's discomfort, there's cramps, there's a little bit of bleeding, you're waiting for that super heavy period following retrieval.
Yeah, I find like I get more like hormonal acne,
my
popping
hair gets
up.
really greasy
My
towards
hair
the end.
starts to like almost fall out and get thin for the first month or two, I find, after the retrieval, and then it comes back. Like, I just notice more hair loss in the shower after my retrievals.
I've heard that before.
Yeah.
Mine got greasy, so I
I
felt like I had
that.
to wash it all the time. Like, it just felt really greasy.
So I would say like similar, like maybe PMS-like symptoms, people will report a range. And really we're playing with your hormones, right? So you're gonna have to expect something, and then it can take, anywhere from a month to 3 plus maybe 6 months, depending on the person, for your hormones to re-regulate after the cycle.
Family history. Hey, I'd like to know if there are any services that do egg donation if you don't know your full family history. I have my mother's side, but not my father's. I'm pretty healthy and generally well-rounded. I'm in it to help some folks out, especially LGBT, and also, yes, for money. Thoughts?
Not going to be for everyone, and it will be a deterrent to some people getting matched, and to other people it won't matter. So it really depends on what the recipient's risk level is, right? Like what risk they're willing to take in terms of family history. Some people are looking a lot more for that personal connection with their egg donor, or they're looking for some very specific physical characteristics or education or just a general attitude. And some people are really, really interested in family history. So, for some people that's really important, but it's going to be different across the board. So certainly, an agency like us, we'd be willing to take you on. It just might take you a little while to get matched.
Yeah, that's a good answer. I think it depends on the agency. Some, they don't want to take you certain banks or whatnot if you don't have a complete medical history. But I don't think that's really possible for anybody, because you only know what's told and passed down through the generations. So we try at least to inform all intended parents that even though we do the best we can to get a full, complete medical background of the family history, that's really not possible, or even there's no way for us to even verify that, or a doctor. So a lot of this is based on that trust that's established between us, donor, and intended parent. And I think the biggest thing is to feel confident in who you're matched with, so that you believe, they're honest and true to who they say they are.
And family history can change too as you age. I've had stuff change in my family's history that I had to update the recipients about, because it doesn't affect their kids now, but it will when they're in their 40s and 50s.
And I think that's important, and something different about us with only practicing known egg donation is that door is always open. It's something that we believe is really ethical and important to everybody. It should be a right to have access to your medical information, and that's not something that's possible with anonymous donation. So egg donors are young and healthy. They're between 21 and 30 typically. So things can change. Like Sarah said, we grow, we age, there's lots that can come up. Same with our parents, grandparents, people pass away, we learn new things. So I think it's important to always have that connection to exchange future health information that changes.
First time egg donor. Hi all. I'm a first-time egg donor, and I'm currently in my stimulation phase of the cycle. I'm super excited about being able to provide healthy eggs to my intended parents, and everything is going well so far, but I am anxious about all and any side effects along the way, especially OHSS. Any advice on things I can be doing to decrease the side effects of the trigger shot especially?
So a couple things I would recommend doing starting now, since you're already on stimulation, is asking your nurse or doctor at your monitoring appointments what your estrogen levels are and how many follicles they're seeing on each side of your ovary. So if you can find out, exactly there's 10 growing on the right and maybe 7 growing on the left, and then how big are those follicles? I know they probably don't want to tell you the size of each of them. If they will, great. I've had nurses write down them for me just on a little piece of paper so I can go home and look at it. Another option would just be, okay, well, what's my lead follicle and my biggest follicle and then my smallest follicle on each ovary. So if they tell you your largest follicle is 1.5 millimeters and your smallest is 7 millimeters, that tells us we've got one that's close to trigger and maybe a bunch that are smaller. Like I'd want to know, that is quite a range. We're not really maybe seeing that big of a gap, but those are things that you want to know so that you can kind of have an idea like, okay, there's 15 on each side. That means there's 30 potential eggs, and that puts you at a higher risk if you're getting HCG as your trigger. So you're gonna wanna advocate for a agonist trigger only, if that's the case.
Yeah, exactly. The most common brand name for that is Lupron, but there are a few that it can go by. But either having a really, really small amount of HCG or even omitting it totally as you get to that higher egg number. if you're looking at like having, 10 or 15 eggs retrieved, then certainly adding some HCG to your trigger in a dual situation can be appropriate in a lot of cases. The other thing you can do is start increasing your protein intake, and just monitoring, being mindful of monitoring your follicles and how many you have.
Yeah. How long would someone want to eat protein for after, like, I know leading up to the cycle, but after retrieval?
For at least probably about a week. But the protein, what that does is your body is building a lot of service capillaries to each individual follicle. So normally it's only having to build one or a couple to service one follicle, right? And so when you're developing all of these follicles, it's got to make all of these service capillaries. And so to make them less permeable, and increasing your protein in your diet is going to help with that.
Okay, interesting.
Stool softeners is another one that you're going to want to think about. So, and this is something that doesn't get talked about nearly often enough, but constipation can be a real issue. And when you have all that tenderness in your ovaries post-retrieval, you're not going to want to have to bear down a lot to move things along. So taking a gentle stool softener like Senna or something like that, starting a couple days before retrieval and continuing until things normalize again, can be really, really helpful.